Hi, my name is Kyler Kennedy. This is my lower distal extremity video. It is November 11th, 2025. We got our little procedure sheet we're gonna do in a row. I have my patient Chloe here. Her pelvic measurement is 22 inches, so we're not gonna worry about the angulation on the AP knee. And then I am going to have her place her foot down. And I'm gonna move her just a little, so we're centered at the right location. There. Calm me down just a hair. All right, that is going to be my AP axial toes, and then I'm going to do the AP axial foot. We're going to open our collimation just a little bit. All right, and for this is going to be 10 degrees. All right, move one more time. And we'll just calm you down just a little. And then we take the picture there. And then we got oblique foot. So I'm gonna take my angulation off. And then I'm going to find her foot. All right. I'm gonna have you lift up. We're gonna be 30 degrees, 2 fingers also works pretty well. Just that. Open up our collimation. That there, that's our oblique foot. And then we got oblique toes. So we're gonna leave that. We're gonna be in the same position. We're gonna collimate down. Here, we center it there. Bring it down, maybe just a hair. Right marker, take the x-ray there. Then I'm going to do the lateral toe. So I'm going to have you turn onto your unaffected side, pull that toe out. Oh my goodness, that's what we like to see. And I'm gonna move her right here. We wanna be centered on that IP joint. Collimate this down just a higher. Put that marker in there. Then I would take that, and then I got the axial calcaneus. So I'm gonna have you bring your foot out and just lay it, flex it, scoot back for me just a little hair. All right. And then we're gonna be at a 40-degree angulation for this one. Make sure we're opened up a little bit. Here. Collimate in just a little bit. Alright. That's our axial calcaneus. Now we're going to do lateral foot. So if I just have you put your foot to the side, stand on your affected side, perfect. I'm going to bring this back over here. This isn't going to have an angle on it. And then we are going to open this puppy up. Alright. Anterior side. And then we'll go ahead and we'll take that. And then we got the lateral calcaneus. So I'm just going to move this just a hair. Collimate in just a little bit. Again, this is our lateral calcaneus. Put that puppy right there. Take the picture, and then we have the lateral ankle. So we will keep her just like that. Center it just a little bit higher. Move that just a hair. There. All right, and then I would take that X-ray, and then I'm going to do the Mortise ankle. So can I actually have you sit on your back butt, please? We're gonna find our central rotated location. Then I'm gonna have you turn 15 degrees this way, so that'll do. Right, we're gonna have this lateral here, or lateral. We're gonna have this on the lateral side, and then we're going to do the medial oblique ankle. So we're just gonna rotate her about 45 degrees now. Move this just a hair, so we're centered again. I might calm it down just a hair. All right, and that is the medial oblique ankle. And then take the picture. Now we got the AP ankle, so I'm gonna have her just sit down like that, dorsiflexing straight up. Put it right between those good old malleoli. I'm really liking what I'm seeing here. Got that. Then I would go ahead and take the picture there, and then I got the AP tib fib. So we're gonna bring this puppy up. We're not gonna do that. I'll bring this up to 48 inches. Gonna open our good old collimation here a lot. And then bring her leg down. We're gonna be mid-leg. See, that's gonna be right here. Right, then I'm going to do lateral side there. I would then all right. That'll have to do. Then we'll do our lateral tib fib. So I'm going to have you turn on this on your right side. I'm going to have you flex. Oh, sweet. All right. All right. Right here. All right. Throw that puppy there. Again, we're at 48 inches, no angulation. I would then take the picture. Now we got lateral knee. So for this one, actually, could I have you scoot down a little bit for me? Perfect. Oh, you know I always appreciate you. All right, now we got, I want to find an inch below here. We want a 5 to 7 degree angle here. Right. We'll collimate way down once we find our spot. And right. All right, and then I would take that picture after, of course, I bring it down to 40. Otherwise, there we go. I want this to actually be green, so I'm gonna maneuver her just a little. There we go. Have you scoot forward just a little bit. Actually, scoot backwards. What am I thinking? And then I would take that image there, remove the angulation for this next one. We got a AP knee, so can I have you get on your butt again for me, please? maybe half an inch below there. Actually got a pretty good marker right there. Sorry about that.
Yeah.
And then go to, actually find where we lit up. There we go. Okay, start there, there, and then move that. All right, then I would take that. Now we're going to do the lateral oblique knee. So now I'm just going to turn you just like that, just a little hair. I'm gonna have you actually there. Perfect. I want to say we're killing it. Perfect. All right. Then I would take the picture there. Now I'm gonna have her rotate medial oblique. Same thing. All right. Sure. Right there. Move this around just a hair. Right. Calm it down just a hair. And then that is the medial oblique knee. And now can I have you get on your knees for me, please? All right, now we're going to do the home blad. So now I'm going to make sure we are at no dilation here. Might rotate this just so I'm satisfied with it just a little bit. Right. I'm gonna be in the mid popliteal area. Right. And I'll be honest, I'm liking that. I would go ahead and take that picture. And then we are going to finally do the tangential patella set of gas. So I'm going to have you lay on your stomach for me. Lift your left leg up for me. And of course, on this last one, I used the right marker. I meant to use the left marker. So let me pull that out, because that is definitely not her right foot. I'm going to center this up. Probably want her, she's vertical right now, so I'm going to try to get 15 degrees of angulation on this puppy. Collimate that way down. That is a very fat collimation we got going. And then we'll place that left marker anteriorly. We'll take the picture. All right.